So let's dive straight into this then. This week is Hereditary Cancer Week. To tell us more is Dr. Julian Barwell, an honorary professor in genetic medicine at Leicester University. He's also a national clinical advisor to the National Hereditary Breast Cancer Helpline and also helped to develop an award-winning prostate male health app. Hey, Julian, how are you doing?
Really well, thank you, Samaya. Thank you so much for having me on.
You're very welcome. Now, one of the things we were speaking about a little bit earlier on when we were speaking about this podcast that kind of focuses on hereditary cancer was this idea that maybe you can't get cancer from your parents or, your grandparents and feeling a little bit silly asking, am I going to get cancer now that my mum's been diagnosed? What can you tell us about that?
Well, we know that about 20% of tumours have some sort of familial link. And about 20% of those, so maybe about 5% overall, are due to a change in a single high-risk gene which can pass through a family. And it's important to remember that could pass through not just the mother's line for inherited breast cancer, but it could also pass through the father's side of the family. So it's really important that you ask about your paternal aunt and your paternal grandmother as well. And what we're looking for in the family history are things like people affected with breast cancer at a young age, so particularly under the age of 40, or if you've got more than one person on that side of the family with breast cancer, or particular links of cancer. So breast and ovarian might suggest a gene like BRCA1 or BRCA2. You may have heard of the Angelina Jolie effect. Angelina Jolie had preventative breast surgery because she had inherited a change in the BRCA1 gene. But also, it's important to be aware of the link between breast, ovarian, and prostate cancer, because prostate cancer can be more common if you've inherited one of these gene changes. And overall, across all inherited cancer, about 1% of the population have one of these high-risk genes. And we know that if you've got one of these genes, your risk of breast cancer is much higher.
And does it depend cancer to cancer as well? Does that play a part in it or not really?
Yes, certain cancers are more likely to be inherited. So the sort of ones we see in clinic are breast, ovarian, and bowel, but even kidney tumors can be inherited, and endocrine hormonal tumors, even brain or upper gastrointestinal tract tumors can have an inherited component, but they're rarer to be inherited. But what we do is we take a family history. And as I said, we look at the age as well. And you're too young to remember the 1980s, but before Simon Carroll, we had Ted Rogers and his dusty bin, and he had a catchphrase which was 3-2-1. And we always say if you've got three relatives across two generations with one diagnosed under 50, for any condition, you should start to think about whether there could be a gene involved. So that's three relatives across two generations, like a mother and son, one diagnosed under 50, then start thinking. And even if you've got two of those three, go and have a chat with your GP.
And would you say only, so I'm just thinking about my own case. My grandma had breast cancer. She died of breast cancer. My mom, fingers crossed, she's not got breast cancer if you think about her, or she's not been diagnosed with cancer, and she's over the age of 50. So in a case like mine, which I'm sure would be the case of many others as well, if you've got one person in your family that's been diagnosed with cancer, what should you do in that situation?
Well, we would ask what age your grandmother was affected. So if she was under the age of 40, then normally your mother would be at a slightly increased risk, and we would have offered her screening between the ages of 40 to 49. But now she's over the age of 50, we probably would say it's less likely she's at the top level of risk. We also these days look at the type of breast cancer, because some of the early, more aggressive breast cancers, we've now been shown sometimes they've been due to a gene change. And if they are, there are new treatments. So it's not just about trying to understand the cause and to work out screening or preventative surgery, for instance. Now, actually, people with breast cancers, there's new drugs which you can actually give, which target the weakness related to these genes. It's what I call the Star Wars Death Star effect. If you understand the plans to the Death Star, you're much more likely to be able to come up and identify its weakness and be able to target and treat it more effectively.
So other than what we've already covered, 3-2-1, that's going to stick in my head. What are the other things that are important for us to know as we raise awareness about hereditary cancer this week, especially?
So a lot of people who are at risk don't know they're at risk because perhaps no one's taken a full family history from both sides of the family. So it's to feel able to have those discussions within your family, and also with your doctor. So that's the first thing. The second thing is to know that there are things that you can do either to pick it up at an early stage through screening, but there are also many lifestyle um, things that you can do. We know, for instance, in the 21st century, sitting down is going to be to cancer risk what smoking was in the 20th century. So our body mass index is going to be really important. And a number of tumor risks are related to our body mass index and obesity. So it is really important that we get the basics right when it comes to not only being aware of symptoms that might be related to cancer and your family history, but also to try and keep active and to try to do what we can to lower our own risk.
Julian, it can be quite a bit of a minefield when it comes to that prevention piece because you might every month, every week, there is something different that could cause cancer or has been, another study's been done to say you shouldn't be eating this or this. Really can be quite challenging to know what you should eat, what type of lifestyle you should lead. How do you navigate all of that as a professional? What would be your advice?
Well, the first thing is balance and perspective, which is most things in moderation are absolutely fine. But if with regards to things like exercise, it's finding things that you enjoy and things that you can access. Even when you're making a cup of tea, can you spend some time lifting a bag of sugar or something like that? Not eating the sugar, of course, but lifting that bag of flour or sugar. Little bits of exercise where you can, making sure you get up from your computer if you have a sedentary job. And the next thing is to speak to your doctor or colleagues or news online groups. So we work with the National Hereditary Breast Cancer Helpline, is go and speak to people who have got the lived experience. There's a lot of information now online with Macmillan and Cancer Research UK, but actually what people need now is to talk to people who have been there, done that, people who have taken preventative drugs or changed their lifestyle or had preventative surgery or worried about their family history. And as part of the helpline, we do have people who not only know about the theoretical side of things and can offer clinical advice, we've got the people who have actually had breast cancer or dealt with their familial risk. And I think that's a really important part of this is to speak to people as well who have been there and feel able to do so.
So that's on the breast cancer side. Looking on the other side of things, I know that you've helped to develop this prostate male health app. Tell us about that, Julian.
Well, prostate cancer is really difficult because many men end up with prostate cancer cells, but not necessarily prostate cancer, or many men end up dying with prostate cancer and not necessarily because of it. So it is possible to overscreen men, and then you lead to problems with incontinence and impotence. So the key is to find aggressive disease early that you can cure in relatively young people, where you've got many good years of life where they can have benefit. So we therefore have concentrated a lot of our work in men who have got African or African Caribbean ancestry, because they're at least double the risk, not only of developing the disease, but dying because of it. So it affects up to 1 in 4 men from that community, but also people who have got a strong family history. And we know that the BRCA2 gene, the breast, ovarian, and prostate cancer gene, is associated with very high risk of prostate cancer. And crucially, it can be aggressive as well. And so screening for that condition is extremely important. There's been some very nice research looking not only at PSA, but also looking at MRI, which is the magnet scan where you go in a tunnel. But there's a big issue with men coming forward. And actually, it's not just about raising awareness, it's about making this less of a taboo subject. Making sure that men are talking to their partners and their families. And we've come up with the concept of Nova score. Don't just know the football score, know your PSA score, know your Gleason score of the tumor. And let's actually start turning the tide on prostate cancer, because too many men are dying in silence. It's difficult to spot with symptoms, and there's so much more we could do to support men.
So, how do you know your score?
Well, you would need to go to your doctor, particularly if you've got concerns about starting or stopping passing urine or back pain. But in particular, if you've got a strong family history, if you remember your 3-2-1 score, then feel free to come and speak to your doctor. Or if you're African Caribbean descent, sort of from the age of 40, 45 onwards. And I think if we do that, we can pick this disease up at a much early treative, but crucially curative stage. And I think it's still a taboo for a lot of men. And I think I'm starting to see the tide change, but we've got fantastic links with a number of support groups, not only the National Hereditary Breast Cancer Helpline, but Prostate, a local prostate cancer charity, Be Me Cancer. You may have seen Colin McFarlane coming on the BBC talking about prostate cancer and living with prostate cancer with Prostate Cancer UK. So we are trying to get the message out there, but crucially also support men. And there are new treatments coming along as well, again targeted to these particular gene changes.
Thank you so much for your time, Julian. It's been really, really helpful speaking with you and breaking all of that stuff down. Dr. Julian Barwell there, an honorary professor in genetic medicine at Leicester University. This week is Hereditary Cancer Week.